Hi everyone, my name is Emma Cooke and I'm a postdoctoral research fellow at the University of Queensland, and today I'm going to be talking about parents' experiences of receiving the diagnosis of Down syndrome. I'm recording on Yagara and Turrbal country, and I like to pay respects to the traditional custodians of the land and pay respects to elders past, present and emerging. I'll be beginning today's presentation with some data poetry. I'll explain data poetry a bit more further on in this presentation, but to start off with, I'll give you a brief overview. We use data poetry because poems have an impact that writing in that hectoring genre prose cannot. And today I'll be presenting a poem that I've written called The Moment of Down Syndrome Diagnosis, which I have constructed using direct quotes, that is words and phrases from parents of children with Down syndrome. There are 11 stanzas in this poem, and each stanza summarizes a different parent's experiences receiving the Down syndrome diagnosis. A traveling person did the scans. Doctors, they gave Janie the option, terminating. She wanted a live baby. 13 years, that's where we left things. Pregnant, waited so long. Pack bags, scan, moved into mum's shed, counselling, mum along. First scan, 20 weeks, doctor called. Is someone with you at home? Don't want you to panic. A chance baby might have Down syndrome. My ex didn't want children. Then Ralph said, let's have kids, meant to be. 21 weeks, diagnosis, changed perception, a week of grief. Test. I was like, yeah, whatever. Put up with all this shit. Do you want to get rid of her? We can organize it. Told I can never have children. Love unconditionally. Told over the phone by myself. I said, what? What do you mean? They didn't have to raise it with us. High risk. I saw her. We knew. Raised it with them 24 hours. Special care supported us through. He took me to a room and said, I believe you've got suspicions. Midwives, they both knew but couldn't say. Need to fly you to Brisbane. Midwife knew the moment she saw. The doctor couldn't see. 3 weeks, quite jaundice. Nurse, she knew, sent me to my GP. Never offered the testing. 4 weeks, breathing. Doctors standing there. They've known since he was born. Nurse came in. Are you going to tell her? 2-3 months old, stopped breathing. He was expecting us to say we, because other parents he did see, they didn't want the baby. So why focus on the Down syndrome diagnosis? Firstly, there's little research on parents' experiences of receiving the Down syndrome diagnosis. And children with Down syndrome are likely to have other comorbidities, for example, respiratory issues. Therefore, diagnosis, the experiences of diagnosis can extend over time, and they can have ongoing impacts for children's outcomes. The existing literature does indicate that the diagnosis is an emotionally turbulent time, but this study and presentation focuses specifically on parents' experiences with the healthcare system around diagnosis of Down syndrome and other comorbidities. So what does the literature currently tell us about these families' lived experiences? Some qualitative studies have investigated parents' experiences of having a child with Down syndrome, and upon receiving their child's Down syndrome diagnosis, parents typically reevaluate their ideas about what normal is, and they really focus a lot on rescuing hope for the future and their child's potential to live a fulfilling life, as the ideas that they had for their child have to shift and change. Medical experiences and a lack of social acceptance are two prevalent negative experiences reported by parents of a child with Down syndrome as well. So the methods for this study, it is a qualitative study, but it's a part of a broader mixed method study as well. But today we're just going to focus on the qualitative components. So that involves semi-structured interviews with 27 parents, 4 fathers and 23 mothers in Australia. And the interviews covered a range of experiences of these families, but we're focusing today on the Down syndrome diagnosis, which we asked about right at the start of the interviews with these parents. These interviews were transcribed for verbatim, and all the names you see in this presentation are pseudonyms. And the methodology being used is crystallization. So this was coined by Laura Richardson, a sociologist, and developed by Laura Ellingson. And crystallization combines multiple forms of analysis and multiple genres of representation into a coherent text or series of related texts, building a rich and openly partial account of a phenomenon that problematizes its own construction. So this is why we're combining poetry, creative writing, and also more traditional thematic analysis in this presentation to sort of crystallize different views and bring them together. So some of the key results we'll be presenting is that, just this general finding, participants had really vivid recollections and evocative accounts of their child's Down syndrome diagnosis, even though in some cases, this was many years ago. Parents really vividly remember these experiences. Negative diagnosis experiences were very common, and some of the characteristics of these negative experiences were diagnoses that were really drawn out, quite ambiguous, and very much focused on the negatives of having a child with Down syndrome. But there were also positive diagnosis experiences, and these included diagnosis without stigma and receiving useful information from healthcare professionals. I'll also be presenting a case study to really crystallize these findings. And I'll also be touching on implications from the study. So to give some examples of negative diagnosis experiences, as I touched on, some diagnoses were really drawn out. So some participants reported waiting for weeks or even months to receive the Down syndrome diagnosis. And sometimes participants also received really outdated information. One participant said there was some terrible outdated information that comes along with the diagnosis. And some participants also described, avoiding any information that was printed before the 90s because it could be quite confronting and distressing for parents. But positive diagnoses experiences look like receiving the diagnosis without stigma and receiving useful information. So this is a quote from a participant. The nursing staff on the maternity ward contacted Down Syndrome Queensland. They asked me if that's what we wanted, and we said yes. That was a really good thing, and to do that in the hospital as well was great before we went home. She came and she had photos of her child and talked about what her kid was up to and the rest of her family and all that sort of thing. And the fact that she'd gone on to have other children and all that sort of stuff was important. They were always very positive about her and us as a family. I didn't get any sort of negative connotations from the hospital. So we see lots of examples of a positive experience in this quote. And this is another participant. The pediatrician was just business. There wasn't anything different. He said, yep, okay, these are the things you're going to need to look at. It was good that he had had that experience with them. It was good in every sense, even in the sense that this is the benefit from the government that you can apply for. This is what we'll need to look at, get in touch with this organization, or this is what we'll need to do next time I see you. It was just a wealth of information. It was good because he didn't treat him any differently. He just knew what to do, but he didn't treat him any different to the girls when we had them. So I think this quote does a great job of showing how this particular pediatrician was treating their child like any child, but also differently, but in a positive way. So recognizing that child would need certain information and resources and providing to them in a non-judgmental way. So as you will be aware, I'm using creative analytical practice in this presentation. We began with data poetry, and I'm about to present a creative non-fiction case study. So I thought it's about time I give you a brief overview of why we use creative analytical practice. These are some criteria we use when we're evaluating creative analytical practice. So the 5 key criteria are substantive contribution, aesthetic merit, reflexivity, impactfulness, and does it express a reality? So I'll give you an overview of how I've aimed to address the criteria in the following case study, just so you can be aware of these key themes as I read the case study. So we have a participant, her name is Whitney. I'll be describing her story in creative nonfiction. I'm trying to make a substantive contribution by showing how social policies, religion and medical institutions shape her experiences. In terms of aesthetics, I've tried to have a playful writing style because I think this really, is a more democratic style. It allows the reader to make their own interpretations. I think is really nice because often participant stories are quite complex and it can be quite hard to pin down their stories into a few dot points. Parents also told their stories evocatively. So, if I'm holding myself accountable to the standards of parents knowing and telling, I wanted to reflect that laughter, that sense of agency in their writing. In terms of impactfulness, I think creative writing has a greater capacity to impact emotionally as well as intellectually than perhaps more conventional academic writing. And I still want the writing to express a reality. So I want it to be an authentic representation of how the participant told their story, while also keeping in mind that sociological perspective, considering how different social forces shape her experiences, such as the National Disability Insurance Scheme and Centrelink, which is the welfare system in Australia. Whitney's life was taking her first child to school and her youngest to kindy. She was pretty healthy. She had put on a lot of weight with the pregnancies, but she was able to take her weight to the store and exchange it for health through proof of walking. Whitney also exchanged her work for her first child. Then the store let her take her work back, a temporary loan. The serious car accident when her firstborn was 11 months old took the work back. Whitney's broken hip and sternum put her in her parents' house. Her healed injuries put her back into work again 3 days a week. Her parents moving put a stop to Whitney's work, as she didn't want to put her child into childcare at that point. Whitney had a miscarriage. Whitney had another miscarriage. Whitney had a 4th pregnancy and a 2nd child. She was classed as high risk. Her 3rd daughter was also high risk. The doctor knew Whitney's beliefs, and in a symbolic ritual, the medical institution knelt respectfully at the altar of religion and recited, "Because you're high risk, I need to ask you anyway, even though I know what your answer will be." No, Whitney definitely did not want to do the test. Whitney wanted to enjoy Bree when she was born, 4 weeks preemie, but instead a pediatrician took her enjoyment and replaced it with a puzzle. How does Bree look? Like her other children? Yes, her husband is Asian. She just looked very similar to her other girls. Why do you say that? A couple of the nurses think she's Down syndrome. That was it. Never said anything else. Whitney worried over this puzzle for the 2 weeks she was in hospital, but she was unable to solve it. On the last day, they took a blood sample to test for Down syndrome. They were sent home and told to come back in a week, and the midwife came out and said, "No, I'm doing the test now." And the pediatrician went off at Whitney. Why didn't she come in? And Whitney called her doctor, who reprimanded the hospital and sent Whitney to a new hospital and specialist. Simple and streamlined care pathways. Bree was sleeping quite a lot. She was tiny. Whitney was breastfeeding her, but she just wasn't putting weight on. They didn't find out until a 1.5 years later the reason why. Spoiler alert, it's the mum's fault, is what they say, and we always trust them. Some doctors have a penchant for diagnosing mothers with being women, prevalence common, symptoms unreliable hypochondriacs, prognosis incurable. Back in hospital 3 times, really sick, pneumonia, severe bugs, pediatrician. Oh, next time we'll investigate, next time we'll investigate. Referral to a health clinic to see a dietitian. Whitney didn't realize it at the time, but they thought she wasn't feeding her baby. Is it just me, or are the lights flickering? Whitney had 3 companions in her bedroom: her husband, her baby, and Fear. She always slept lightly with Fear, who muffled her ears as she strained to hear her baby's breathing, or lack thereof, from the cradle, and later cot beside her bed. 4th time, Floppy, not responding, wouldn't wake up. In the ambulance, there is a man, and he insists, a different hospital. Intensive care, surgery to take out her tonsils and adenoids. Her airway was just like a pin drop. Bree was using up all of her energy to breathe. That's why she wasn't putting any weight on. Airways opened, a light switched on, and Bree started developing. Whitney's girls really felt it. Oh, everything's about Bree. I'm so over this, the elders complained. The middle child was quite clingy and always wanted cuddles. They stayed with their grandma and granddad when Whitney and Bree were in the hospital and their dad was working. Whitney's husband had a massive car accident, fell asleep driving home. He was in a coma. He had sleep apnea. He would just sit down and fall asleep. He hasn't gotten treatment for it because he's stubborn. He's lost a bit of weight though, which has helped him sleep better. His snoring disrupts Whitney's sleep every now and then. She tries to go to bed before he does, so she can't hear it. Whitney is classed as Bree's carer, although she hasn't applied through Centrelink to get the carer's payment. She's just doing the carer's allowance. She didn't organise it properly. The problem was Whitney was too busy being Bree's carer to prove it to Centrelink. Whitney was ill-prepared, having never tangoed with them before. She had called Centrelink because they were cutting something off. They wanted Whitney to find work. She would have to search, find so many jobs and report it. Answer this riddle. If a job application falls in a forest and Centrelink is not around to hear about it, does it make a sound? Complete this quest. Retrieve the diagnosis letter, scavenge for the correct Centrelink forms, and ask your doctor to fill them out. Whitney needs to take her daughter to appointments. If she was to work, who would do that? Sometimes it's frustrating. How are they going to make ends meet? Whitney was a hairdresser, and there's times when she gets itchy fingers. She wants to go back and do that creative stuff again. She's been approached with work opportunities and gets excited, but it just doesn't feel right. Now is her time to be there for Bree. Now to summarize the results. Normalizing is really key to parents coping with the Down syndrome diagnosis. So even as they described how their lives were profoundly impacted by having a child with Down syndrome, they still really felt that their experiences were also normal, much like any other parents. And this normalization is really contextualized by parents' desire to defend their child from prejudiced attitudes that many have encountered from the moment of diagnosis, as you would have seen in that original poem at the beginning of this presentation. Many parents reported experiencing an initial period of shock and grief upon receiving the diagnosis, and that normalization, that attitude of just getting on with it, was really helpful for them in moving on with their lives. But parents also really focused on describing how their child improved and enriched their life as well. There are some positives and potential pitfalls from this normalizing. Sometimes healthcare professionals also normalize, and parents might really value this normalization. So when doctors just treat their child with Down syndrome just like any child, parents really appreciate that. But there's also a dark side to this normalization, this kind of attitude that, oh, that's just normal for children with Down syndrome. It can potentially be a prejudiced view that puts a child at risk of inadequate treatment and poor outcomes, as we saw in Whitney's story, where she was repeatedly going to the hospital, but her child with Down syndrome was not receiving adequate care. And this is another quote from a different participant. One of the doctors told me, oh, that's normal for Down syndrome. It puts a blanket over the situation. It's like saying, oh, you have a heart defect. Oh, this is a common heart defect, so we'll just leave it. I think that does a great job of summarizing the pitfalls of normalization. Negative healthcare experiences and patterns of normalizing can create a challenging context for delivering care for these families. Implications will include, perhaps professional development for healthcare workers that could focus on awareness of families' tendencies to normalize their experiences when delivering care, recognizing families encounter prejudice, both in and outside of the healthcare system, and to really balance, the positives and pitfalls of normalizing to maximize access to healthcare for these families. and improve these children and families' outcomes. Thank you very much.